Hello friends, I am Dr. Professor Rakesh Chopra. I have the honor and privilege to have started medical oncology, that's medical treatment of cancer, and hematology, medical treatment of blood diseases, blood cancers in North India. I'm also a professor with the University of Nebraska, where I do my teaching also. I'm an adjunct professor there. Let me first define that lung cancer can be due to tobacco and could be due to non-tobaccos. So that means that both men and women are prone to cancer of the lung. The behavior of both the diseases may be slightly different, but 60% is due to about tobacco and alcohol, but 40% can be because of other reasons. Now, for example, ladies, they used to cook on open fires, wood fires, coal fires. All this, you are inhaling poisonous material which can give rise to these cancers. So lung cancer can be in males, it can be in females. It can be due to tobacco, it can be due to non-tobacco. And the commonest problem in our country is that it is mistaken, and a lot of people start treating for tuberculosis without establishing a diagnosis. It's very important to establish the diagnosis from an infective region. A pneumonia, tuberculosis, or commonest is tuberculosis in this country. And then, unless you establish the cause, don't get into treating the disease. That's the first. Now, the commonest symptoms of patients with lung cancer could be cough, which may be productive, may not be productive. The cough, which does not go away for about 2 weeks, you must get it checked properly. An X-ray alone may not be enough. You may need a CT scan and other investigations to establish a diagnosis. So cough, breathlessness, unexplained breathlessness, one has to be certain. Then cough with expectoration. That means there is a phlegm coming out from the thing. One has to check that sputum for malignant cells. Then hemoptysis. Hemoptysis means blood in the cough. That can be due to tuberculosis, it can be due to pneumonia, but it can be due to cancer also. So you have to do that. Second thing is this, that how do you establish the diagnosis? You establish the diagnosis first by a good history, a good clinical examination. You examine the patient thoroughly. Then, after that, you have to examine routine blood tests. You have to do the liver functions, kidney functions, CPC, all these routine investigations. What has been seen is that if a person has been smoking, say for how many packs per year smoking, then the screening is done by a low-dose, high-resolution CT scan of the chest. That can pick up disease quite often, quite early. So an HRCT checks, especially in a high-risk person, that means a person who's been taking tobacco for many years. These are the people in whom you can pick it up early, and then whatever treatment you need to do, you can do early, provided that they go for the screening. Second thing is this, if a lady has symptoms, as I said, she must also get investigated. The other investigations are bronchoscopy, putting a tube into the airways. There is EBUS, that means endoscopic bronchial ultrasound, by which you can biopsy these patients, or you can suck out secretions from the airways and get them checked for malignancy, or you can take a biopsy. So these are very important things. Now, coming to treatment, we nowadays do a lot of tests on this tissue. That means that you take the biopsy and then you get it tested for what we call as, besides the histopathology. If the histopathology says it's small cell lung cancer or a non-small cell lung cancer, or it's a a large cell lung cancer or an old cell lung cancer. Then the lung cancer is of various kinds. They have certain molecular markers. These molecular markers can be tested on that tissue. These molecular markers can also be tested from the blood, which is called as liquid biopsy. That means that you are able to, from these molecular markers, pick up if these people, if these tumors have a targetable or an actionable mutation. Because if they express a certain mutation, then you can give them treatment according to that mutation. So it's very important to be able to test this material both from the tissue and from the fluid, sometimes from the blood or from the pleural fluid, that is the coverings of the lung. So it's very important to do these things. Sometimes there are certain areas of the lung you cannot reach for a biopsy, in which case then you have to do this liquid biopsy, which can give you the same information. You can take out circulating cancer cells, you can take out circulating DNA, RNA, proteins, and that will give us the answer on the behavior of this tumor and what should be our treatment or our therapeutic intervention. Today, you can treat advanced lung cancer with just a single tablet, provided that it fits into that particular type of lung cancer, which expresses that kind of molecular mutation on its surface, etc. So, please, my message to you is very clear that please don't let people fool around with antidiluvial drugs and all kinds of anti-infective drugs, because if you go to the doctor early, you can get a good outcome. You go to the doctor late, your outcome will be always worse. So please get it checked by proper doctors who know how to investigate and then treat these patients. Because very often a cancer can be missed and you may go up the wrong path by treating tuberculosis or infections or something else, and you may miss the cancer.